This video will show you how to obtain additional doses of epinephrine from a single-use epinephrine auto-injector in situations in which there would be a delay to emergency care. This technique is used for emergency scenarios only. One must be very careful as the auto-injector is spring-loaded. Take care with the exposed needle once open. The auto-injector is cut open starting at the top of the pen. Start by cutting around the outer edge of the auto-injector. The injector should be rotated as you cut, rather than cutting directly through. The spring mechanism will cause the plastic end to launch once you are through. Be sure the end is not aimed at another individual, as it can launch with some power. The next step is to remove the spring from the exposed needle and plunger system. Here you can see all of the parts once exposed with the exception of the spring. 3 to 4 additional doses of epinephrine are within the glass syringe. The needle is covered by an easily removable rubber cover. The plunger must be drawn back to reload a dose, as it is designed to give the exact dose of epinephrine required. There are no units or markers on the glass, therefore the plunger will be your guide. As you can see, the rubber slides off the end easily. This auto-injector was deployed before opening, and the plunger cannot go any further until reloaded. To reload, carefully pull back on the plunger. This will draw air through the top of the needle. Now when you flip over the syringe, the air bubble will move to the top and your syringe is reloaded for a next dose of epinephrine. To reuse this syringe, insert the needle into your patient's thigh and use the end of the plunger to give the second dose. Due to the shape of the syringe plunger, you will not be able to give too much epinephrine. It will give one single dose. These steps can be repeated to give additional doses of epinephrine until you are safely out of the woods and in the care of advanced medical professionals. Be careful not to pull the plunger too far back when reloading with air, as it can come out of the syringe and you'll lose the precious epinephrine. Hopefully this is something that you never have to do, but it is an important trick to keep in your back pocket when out in the wilderness. Be safe out there.